You've been really helpful, and I want to thank you and your family as well as your team for showing up at Bucktail. The things that you did, your passion for rural healthcare just showed. Everybody that was involved with that project got to see that. And we were, I mean, with Representative Borowicz, the Clinton County Commissioners, the Senator Fetterman and Congressman Thompson. It was an all hands on deck experience, and it was nice to see there was bipartisan support. But you were the key. I mean, you were the focal point to helping get things done. We had some changes with the administration that really helped, but then you went to work with the insurance providers, and I think that's a part of what your rural health plan is. Do you want to touch a little bit on how you worked with those insurance providers to help this, and then also if you want to touch on some of the other things that we're doing up there to provide additional revenue streams? I appreciate it.
Yeah, sure. So yes, it's definitely a labor of love. I am passionate about the work, the people. At the end of the day, all of these communities are just filled with really wonderful people. And I think at the end of the day, that's what motivates myself, my family, my team, is to really serve the people at the end of the day. As it relates to, it was a mess. Stepping in with the headline, hospital to close within a couple of days. And truly, the hospital is still open, Bucktail is still open today because of a community response. And so while, I might have been the one privileged enough to lead the effort, it wouldn't have happened without, I would say, a rallying of a lot of different community folks, including the payers and including other healthcare providers. So, things were so dire. I like to say I leveraged probably every relationship that I had built to date to keep Bucktail open, calling a lot of the hospital leaders that I had, relationships with, saying, hey, I need your help. I had one leader personally stock her SUV with supplies from her hospital and drive them there to make sure the nursing home had what it needed. Within a couple of days, Geisinger sent a truckload of supplies that they donated. Because we inherited where, most of the suppliers, because of lack of payments, were not willing to ship supplies.